Flatfoot is a common foot condition in which the medial longitudinal arch of the foot collapses. Babies are usually born with flexible flat foot. At the time of birth, a fat pad is present underneath the medial longitudinal arch. It is thought to resolve between the age of 2 and 5 as a foot arch is formed. By 2 years old, a child usually develops foot arch that is visible when sitting. This arch may collapse with weight bearing, producing the appearance of flat foot. The medial longitudinal arch of foot remains stable from 7 to 9 years old. The normal foot arch develops along with the bones, muscles, and ligaments within the foot in the first 10 years of life. Flexible flat foot usually resolve by the age of 10, yet in some people, it proceeds into adolescence and adulthood.
Flat foot can be divided into flexible and rigid flat foot. Flexible flat foot, the arch exits when sitting but disappears with weight bearing. Mostly are asymptomatic. Children with asymptomatic flexible flat foot should be monitored clinically for onset of the symptom and sign of the progression. Symptomatic flexible flat foot may result in complaints like in the foot pain, knee and hip pain, reduced in endurance, abnormal walking pattern, and calf muscle tightness. Rigid flat foot characterized by a stiff, flattened in both weight-bearing and non-weight-bearing position. It is often associated with pain and more serious underlying pathology such as neuromuscular process.
Is it normal to have flat foot?
Yes, flat foot is normal in baby and toddler because the arch in their feet haven't yet developed. The foot arch develops throughout the childhood for most of the people. However, some will never develop arch in their feet. Arch can collapse due to age, wear and tear in the body, or from an injury.
What causes the development and persistence of flat foot?
We may consider some predisposing factors such as body composition. Obesity and overweight can lead to collapse of the foot arch by the increased load on the foot. Ligament laxity may also be prone to flat foot due to impairment of the arch development. Family history. Positive family history of the flat foot may be another important factor. Gender. Male are twice more prone to have flat foot than female.
Is it possible to correct the flat foot?
Exercises are effective in improving the arch in some people with flexible flat foot. As part of the assessment process, the physiotherapist will check for the type of the flat foot, evaluate the walking pattern, and the impact of the foot deformity on the functional activity, not just the structural abnormalities. The recommended exercise program are modified depending on the child and the family needs. Physiotherapy treatment will help to regain the movement, strengthen the ankle and the foot muscles, improve the balance, and hence optimize the daily activity.
Where should consider for the treatment?
It is indicated if there is discomfort or pain in the foot or calf, frequent change in activity level and function before pain develop, rigid flat foot at any age, abnormal weight-bearing position of the foot with associated sign of abnormal foot structure, change in walking pattern associated with flat foot.
Does the footwear also influence the foot arch development?
There are evidence shown that shoes may be a contributing factor. The study found that kids who wore shoes in the early childhood were 3 times more likely to develop flat foot than those who unsewed. Barefoot walkers had widened feet and distribute the pressure on their feet more evenly.
What types of footwear are good for feet?
Children are encouraged to play unshod during the stage of development. Toddlers are advised to wear more securing footwear, such as the sandal. Once the child reaches school age, parents can then consider loosely bound footwear, which is closer to the barefoot environment rather than the closed-toe shoes, to promote healthy foot arch development.
Is customized arch support insole helping?
Arch support insole cannot fix the flat foot. It may relieve the pain or discomfort, mitigate the plantar pressure, and maintain the dynamic stability in weight-bearing position.